Motivational interviewing is the newest evidence-based practice that is sweeping the nation. You may be thinking to yourself, what is motivational interviewing and how can I get in on it? Don't worry. Stay tuned to KMSW and we'll fill you in on all you need to know about motivational interviewing.
Are we on the air?
Motivational interviewing has been around since 1983 and was developed by William Miller and Stephen Rolnick. From their work with problem drinkers, they developed a goal-oriented, person-centered, directional method of communication for enhancing intrinsic motivation by exploring and resolving ambivalence about change. The primary goals of motivational interviewing are to reduce and minimize resistance, explore discrepancy between behavior and values or goals, resolve the ambivalence, elicit change talk, and move into behavior change. Let's go now to Jerry Allen at the Bus Plaza for more in-depth discussion about motivational interviewing.
I'm Jerry Allen at the Bus Plaza, and these are some of the theories we use in motivational interviewing. Person-centered approach, where the client is the expert and the social worker is the guide to change. Stages of change model. Match the intervention with the stage your client is in. Pre-contemplation, contemplation, preparation, action, and maintenance. Strengths perspective. Search for the client's strengths and help build upon them. Self-determination theory. Support your client's decisions.
Wow, motivational interviewing sounds great. What else should you know about motivational interviewing?
Hi, my name's Candace. I practice motivational interviewing and I have some cool ways to remember some of the techniques and principles. Express empathy through accepting and reflective listening. Develop discrepancy between current behavior and hopes for the future. Avoid argumentation and direct confrontation. Roll with resistance. Support self-efficacy and optimism. Minimize problem solving and advice giving.
So now you know what motivational interviewing is and how it was developed. Now Jerry's going to tell you some of the techniques to help you master the art of motivational interviewing.
You always remember to establish rapport with your clients. Use open-ended questions. Roll with resistance. Collaborate with your client. Use scaling questions, and you can scale for motivation, importance, and even confidence. And of course, you must be a reflective listener.
And the great thing about MI is that it works in every treatment setting, especially in drug and alcohol, medical treatment adherence, mental health settings, and my personal favorite, those mandated clients.
This sounds way too good to be true. Are you sure it isn't on quackwatch.com?
Here at KMSW, we would never steer you in the wrong direction. Motivational interviewing is an evidence-based practice and has been proven to be an effective treatment modality. In a meta-analysis completed by SAMHSA, they did a randomized control studies of adults ages 18 and over regarding their alcohol and other substance usage. They found that participants that were in the MI control group had reduced incidence of drinking, they had reduced negative consequences associated with their drinking, there was lower amounts of drinking and driving. Also, participants had reduced their quantity of alcohol consumption and reduced cocaine and heroin use. Those participants that had MI stayed in treatment longer and were abstinent 6 months after participating in the motivational interviewing sessions.
I like that. You like that?
Also, In social work and mental health and evidence-based approach, we found that Hester and Miller in 2003 used results from Project Match, a study funded by the NIAAA that indicated that 4 sessions of motivational enhancement therapy were as effective as 12 sessions of the comparative treatment of coping skills and 12-step facilitation.
I use motivational interviewing in my practice, and I get great results.
Motivational interviewing has made me a more effective practitioner.
This is a lot of information. You probably want to practice motivational interviewing after hearing all about it. Call now and order our How to Use Motivational Interviewing DVD, which includes more information, research studies, and real-life scenarios. And it also shows a clinical social worker using motivational interviewing. We'll preview a few of those techniques like rolling with resistance, reflective listening, developing discrepancy, avoiding arguing, open-ended questions, and summarizing. Don't forget, call now to get your copy. Don't forget, there's 12 roadblocks to motivational interviewing. 1. Ordering, directing, or commanding. 2. Warning or threatening. 3. Giving advice, making suggestions, and providing solutions. 4. Persuading with logic, arguing and lecturing. 5. Moralizing or preaching. 6. Judging, criticizing, directing, and blaming. 7. Agreeing, approving, and praising. 8. Shaming, ridiculing, and name-calling. 9. Interrupting or analyzing. 10. Reassuring, sympathizing, or consoling. 11. Questioning or probing. And 12. Withdrawing, distracting, humoring, changing the subject. And those are the 12 roadblocks that we have to watch out for with motivational interviewing.
I spent 20 years trying